I am your guide through administering Abby's medications.
You do have to sign
We have
this.
flagil, which must be refrigerated when not being used. It is also a suspension, so right before you give it to her, a little bit of a shake. It has 3 mLs written on here. So what we're going to do is take off the top, use one of our handy dandy 5 ml syringes, extract until we have 3 mLs of flagil. Put the cap back on. Take the flagil. Our Sleeping Beauty is sleeping. We have her extension, which is attached to her. And while you might not be able to see it on the phone, there's water inside of it. So we need to be sure that there's either water or milk in the syringe, in the extension, and that there's no air. Otherwise, she's going to get a ton of air in her belly, and that's not good. So this extension is full of water. We want to make sure before we open any of the ports that this white clip is clamped shut. Now that it is clamped shut, we're going to open the small little port on the side. This guy right here. And leaving the top one open.
Closed.
And leaving the top one closed. I'm going to place the tip of this syringe in the side one. I'm going to unclamp this white clip. Something I have learned the hard way, if you're going to push this through, this top cover right here does have a tendency to fly open and spit medicine in your face. It's not good. So before you push the medicine from the syringe into the extension, keep your finger on the top of this part right here. Squeeze it through. Before you remove the syringe from here, and make sure you take this white clip again, clamp it again so that it's closed. Now you can take out the syringe. Check and double check and triple check this little side port. Make sure that it is closed. Oftentimes when she's feeding, if this is not all the way closed, it will leak out and make a big mess and cause lots of unpleasantness for everybody.
Okay, and now you need to flush it through.
And so flushing, I will now show you.
The water you can just get from the refrigerator dispenser of water, because that is filtered water.
Now I have one of our handy dandy 35 ml syringes. It's all the way closed. It's all the way pushed through. And
You
then
just need 15.
you just need 15 mLs. And what do you know? 15 mLs of water. Now, I'm going to take the syringe. The white clip is clamped. It's going to stay clamped. I'm now going to open the top port, the big one. I'm going to stick this in. And I'm going to unclamp the clip, this handy dandy white clip here. And kind of like before, where we wanted to hold the top one closed, before we push this all the way through, we want to hold the side little one closed while we push it through so it doesn't fly open. When you do it, don't just slam the water in there. Do it nice and slow. And what this does is this pushes the medicine through the tube so that it gets into her belly. Now that this is done, before we remove the syringe, we're going to clamp this white clip, take out the syringe, and we are ready to go for the next medication. So I'm now going to close this top port again, and now we are ready for the next one.